Hi everyone. Today, our group will be talking about the fatal disease rabies, the bite that is worse than its bark, by Kendall, Caitlin, Victoria, and Sophie. Rabies is a fatal disease that is very well known, but a lot of people do not understand the effects and the seriousness that comes with this disease. Although most people have heard of rabies, it is important to define and understand what rabies is and what happens when one is infected. Rabies is a disease that is transmitted through bites, scratches, and salivas from an infected being. Rabies attacks the central nervous system from the infected site. The virus will spread through the peripheral nerves, and then from there, it will travel to the brain. Once it reaches the brain, it replicates and causes neurological symptoms. The virus invades the immune system and causes serious harm by moving from neuron to neuron. In the end, this results in death if there has been no prior medical care prior to the incident. And now we're going to look at who it affects. Rabies is primarily found in wild animals, such as foxes, dogs, raccoons, and bats. But all of these animals can attack, and then they can transfer the disease via bite or scratch to humans, pets, or other animals. Rabies can be found worldwide, but according to the World Health Organization, up to 95% of human deaths occur in Africa and Asia, where dog rabies is poorly controlled. Although rabies is not the most common in the United States, it is necessary to be educated and aware of the harms that this disease can cause. People in the United States that are at the highest risk are hikers, people who live in wildlife areas such as rural areas and ranches, people who travel, and people who work with animals. It is important to note that in the United States, more than 90% of reported cases of rabies occur in wildlife.
Once bitten, the virus can remain in the body for 2 to 3 months before symptoms appear. The timeline depends on where the virus entered the body. In rare cases, rabies has spread through organ transplants from infected donors. In early stages, symptoms are flu-like and can include fever, headache, nausea, insomnia, and usual sensations like tingling or burning at the bite site. As the virus progresses, it can take one of two forms: furious rabies or paralytic rabies. Furious rabies causes severe symptoms like hyperactivity, hallucinations, and hydrophobia or fear of water. It leads to the death in few days from respiratory failure. Paralytic rabies, though less dramatic, is more prolonged and could eventually lead to death.
You're probably wondering, how do rabies get treated? Well, you are in luck because if you do ever happen to get rabies, some of the treatments, as stated by the CDC, Centers for Disease Control and Prevention, are one, wound washing, which is where the rabies wounds on the body need to be cleaned very thoroughly with soap and water, and two, getting a rabies vaccine, either the non-immunized or immunized shot, depending on the individual's medical history. If the individual is non-immunized, meaning they are not immune to a certain disease, they would get the post-exposure prophylaxis for non-immunized individuals vaccine, which includes treatments such as getting a full dose of the HRIG vaccine, which stands for Human Rabies Immune Globulin, on the rabies wounds, and another given vaccine, either the HDCV or PCECV in 1.0 milliliter in a specific area of the body. On the other hand, if the individual is immunized, meaning they have been vaccinated before and after having rabies, they would get the post-exposure prophylaxis for previously immunized individuals vaccine, which includes treatments such as not getting the RIG vaccine, which stands for rabies immune globulin, but either the HDCV or PCECV vaccine in 1.0 milliliter in a specific area of the body as well. As treatments for rabies exist, there are also ways in which we can take prevention measures against rabies in certain situations and its transmission from animals to humans. So the question is, how can we prevent rabies? Well, some of those preventions, as stated by WHO, the World Health Organization, are one, vaccinating dogs and animals to prevent the transmission of the rabies to humans. Two, bringing awareness by educating the public about certain animal behaviors, getting bitten or scratched by an animal, and letting pet owners know how to be responsible of their own pet vaccinations. And three, lastly, getting people vaccinated against rabies.
Spreading awareness. As we have covered, rabies is transmitted through the saliva of infected animals, such as bats, raccoons, wild dogs, foxes, and other mammals. Therefore, the best way to avoid the spread of rabies is by avoiding contact with these animals in the first place. While rabies in wild animals is not extremely common, you can never be so sure, especially since a newly infected animal will not show signs and symptoms right away. Another way in which you can prevent the spread of rabies is by making sure that you and your relatives' animals are up to date on their vaccines. Most responsible pet owners will make sure their animals are up to date. However, it is not only important for their safety, but for your safety as well. Acting fast. It is important to act fast. If you think that you or someone you know has been exposed to and is at risk for having contracted rabies, contact a provider right away. As we previously mentioned, you will be administered a rabies vaccine, which consists of 4 shots over the course of 14 days. This will significantly decrease the risk of incubation within the body. The vaccination process will not work if you hesitate for too long and go to the doctor too late. Once the virus is fully incubated in your body, it may be too late. Further prevention and safety measures. Another way that we can help spread the awareness of rabies is by letting people know further methods of prevention and overall safety precautions. If you think that you are at high risk of being infected, such as working with wildlife, domestic animals, go around bats or caves often, work in a lab where you deal with viruses, travel a lot, then you may be eligible for PrEP, as we explained earlier. It is possible to survive rabies. If you are quick and cautious, then you will end up like most people who act fast, alive. However, once the virus is incubated, there's a high chance of mortality. So once again, take this virus seriously. It is not a disease that exists in zombie movies only, but rather something that is present in almost 150 countries and territories around the world. As someone who now knows more about the rabies vaccine than the average person, it is up to you to avoid the risk factors, identify possible infection, and take action if necessary. Thank you.